About to go live. Right. Good afternoon, everyone. It's 3 a.m. Saturday. 3 a.m. Feels like 3 a.m. I guess I was just waking up. 3 p.m. on Saturday, June 5th. I want to thank all of you for joining this afternoon for a very important conversation. From the response that I've got and the calls that I've got, this is a discussion that people are very interested in. And so I'm glad that we have a host of very knowledgeable, passionate individuals on the call with me this afternoon. This is my largest panel since I've been doing my budget conversations. I think last year I had 5 at some point, but today we have 6 individuals that are spending their time with us to be able to talk about our public safety costs. And so I want to thank my panelists for being here. Thank you for joining us. Thank you for all that you do and willing to educate me and the public on where we are. And so, like I said, we will be looking at our public safety costs this afternoon. And the question we're trying to ask, or maybe answer for some of you, is whether the cost of public safety is too high, or whether it's not high enough, whether we're not doing all that we can, or maybe we're doing too much. And that's the question. And as an at-large council member, I've heard varying opinions. I've had people that said we need more police from different parts of the county, whether it's east or north or west. And I've had people that said, look, this is not what we need to be doing. We need to do something better. And so that's a conversation that everyone is having. That's the question people have, and that's people's opinion. And so I thought for this budget session, let me bring in individuals that have more knowledge than I do on the topic to be able to address you, talk to you, and answer your questions. So today with me, I have Deputy Chief Chris Taylor with MMPD. We have Mr. Michael Rudolph, who is with MHC, an organization that will be partnering with MMPD. We have Mr. Andrew Crinks and Ms. Theda Murphy with the People's Budget Coalition. And we have Ms. Christy Armstrong, who is a community member that lives in Antioch. And we have Dr. Phyllis Hildreth. A lot of you know Dr. Hildreth. She's part of COB. She does a lot in the community. She was part of the 37208 commission that was put together by the vice mayor. And so those are the people that will be talking to us this afternoon. The way this goes is that if you do have a question, please type it in your comments on Facebook. I will be looking through that. And my new intern, Miss Alisa, is on the call also, and she will be looking through to make sure that we do not miss any of the question. In the past, if there's so many people and so many questions, sometimes we do miss one or two. And so if you feel like your question is not asked, then please text me. You can text it to my cell phone, 615-585-2558. I'll be checking those messages as well to make sure that we catch all your questions. I also ask that because this is a very hot topic and we have varying opinion, I will ask that everybody should please be civil. Even in asking your question, just ask the question. No name calling. State your opinion, state your question, and we would. If anybody is rude or not adhering to those rules, I reserve the right to not read the questions. And so, but I want to answer all the questions. I'm just saying, just write the questions, and let's be polite to each other. Same goes for my panelists. I will ask that you don't engage each other directly. Let's just listen to each other. And if you do have questions, you have the option to put your question in the chat box, and I will be looking at that. So with all of that, it seems like a lot of stuff, but I think it's important that we do that. The other thing that I want everyone to know, you may not have noticed, is that this session is an hour and a half. Typically, our session is 1 hour. We did 1 hour and a half about 2 weeks ago when we were talking about the referendum and reappraisal. And I felt like this is a topic that we have all these knowledgeable individuals here. I want to give them ample time to be able to address your questions. So thank you also very much for joining, and thank you to my panelists. So I'm going to start with Deputy Chief Chris Taylor. And so, Chief Taylor, if you would walk us through the MMPD budget for this year. Like I said, public safety is big, but it's not just MMPD. It includes EMS, includes the sheriff, includes the fire department. But I know usually when we say public safety, everyone wants to know about MMPD. We cannot bring everyone, so MMPD is what we're focusing on now. So if you can walk us through your budget for FY22, your proposed budget, what is in it? What do you want us to know? What are the new programs? What are the additional things that needs to be funded that you're asking for? And just walk us through it as best as you can, Chief Taylor.
Yes, ma'am. And Councilwoman, I want to tell you, thank you so much for putting something like this together. I think it's extremely important that we reach out every possible way for the public, so that way people that have questions maybe sometimes don't feel confident coming to a council meeting or have the means to get to a council meeting. And I think it's fantastic you're doing this. I just want to tell you thank you very much for all of us, and I appreciate your representation in this matter. I think the most important thing to say about the police department's budget this year, more so than any other year, is Chief Drake has challenged us to really rethink the way we do things, the way we police, and the way we serve our community. And I'll start by saying in the past, maybe previous administrations have done what they thought was appropriate at the time, but in hindsight, we see maybe were more detrimental than they were helpful. And so we've kind of rethought the way our department polices all together. And he came up with three main legs, and one was organizational excellence, where we streamlined a lot of the resources in the department so that we could save money, where before maybe, and I'm not saying there was fat or anything like that, but we've just consolidated and put a little more work on some people, and they've been good about it. Then we've also rethought the way we do things. He created the Office of Alternative Policing, which we'll get into in a minute. He created the Interpersonal Services Branch, which ties domestic violence, youth services, sex crimes, and now our newly formed division of family intervention, which is made up of strictly counselors, people that help victims of crime deal with it. And that's been a big focus for the chief, as he wants to make sure that we service everybody in the best way we can. And some people weren't serviced enough. They weren't an emphasis at times, and he's really done that. In fact, the interpersonal service branch, that is something that we haven't found anywhere else in the country. And it's completely new, and it's been really received well by our advocates, which is domestic violence, the different advocates for sexual abuse, human trafficking, everything else. And we're putting an emphasis on things that maybe we haven't done in the past. Before, the focus might have been, hey, we want this many traffic stops. Now it's we want to make sure we do the best service for the person and the problem at hand. Going on to the next leg of what he's planning on doing is it's precision policing. And what that does, it's a focus of, instead of maybe where before we would target one area and have blanket approaches to crime, where you might have a lot of traffic stops, you might have extra patrols in that area, and sometimes that over-policed areas. There's no doubt about it that people that shouldn't have been stopped maybe were getting stopped, and I think we saw that in the Driving While Black report. So what he's done is he said, hey, we're going to put more of our analytics together. We've really put an emphasis on working with our federal partners, and what we're trying to do is make sure and target the most troublesome people we have. What we've learned is that if you're involved in a shooting as a suspect, the high likelihood is you're also going to be involved as a victim, and vice versa. And we've seen across the country a dramatic increase in shootings and homicides. We have to some degree, but thankfully it's been a blessing in our community that we're not nearly as bad. And part of that is because he's refocused how we're doing things. Before, we would have homicide investigations that were done at the precinct level. That meant each individual geographical precinct would do an investigation. Well, you lost a lot of the resources because you only had 1 or 2 detectives doing it. So the biggest part is on a homicide, that first 12 hours, 12 to 24 hours, chasing down every lead you can, because they start getting cold pretty quick. I think we're all familiar with the process just from TV. Well, what Chief Drake did was, while he was the interim, he combined all of it and gave us a centralized homicides unit. And it's amazing. That started in October. We've had 100 homicides, or actually 101 after last night, since then. And out of those 100 homicides, only 6 do we not have a very strong, viable lead and towards solving and catching the person responsible. And we think that's a really big thing. Is we've kind of created a hierarchy of crime that says you have to address some of the most violent things so that people feel safe. Another emphasis that we've done is through just the idea that everybody, it's a do no harm policy. And he's impressed upon our department that applies internally with our own employees and also externally with the way we deal with the public and everything else. It doesn't help. If we're making more harm than good, then what we're doing doesn't work. We don't need to do it. And so we've reevaluated a lot of the way we've approached it. An emphasis was maybe looking at the way our diversity was. I know that came up with a lot with the policing commission. And I will say, as an exciting part, I think everybody's familiar with the mayor's policing policy commission that was put together last fall and then came up with recommendations towards the end of the year. I'm proud to say that by this September, when the commission initially first met, we will have implemented all of their suggestions that they put forward to us. So everything will have been done. A big part of that was our recruitment, our diversity, and we put a huge emphasis on it. I can tell you some successes we've had there. We're running a lateral class. We're looking, which is where you bring in officers from other departments. They're certified, they're trained, so you can put them on the street sooner than the year it takes to train an officer. Well, by doing that, we recognized last year we tried to run a lateral class, maybe 10 officers. I think we got 11 officers wanting to come here from other departments, which says a lot about our department in a poor way. This year, since we've done that lateral class, we've had 140 applications. And the exciting part of that is 58 of those applications for female employees, potential employees, and minorities. So we're very excited. In the recruitment that Chief Drake has put an emphasis on, we redid the way we recruit, we redid the way we're doing backgrounds, and we're seeing the results already in the applications we're receiving. It's some of the most diverse applications we've ever had. And the same thing, we recently gave a promotional test for sergeants and lieutenants. The assessors that came in from other departments around the country to help us gauge and grade all said the same thing. They said, it's amazing the people you have here, and it's one of the most diverse groups they'd ever seen. And that's a direct reflection of Chief Drake and his emphasis on it. Now, getting back to what we're doing new this year, our alternative policing office, and I'll defer to Michael on some of it because I don't want to steal his thunder, but one of the things we've got going, obviously, as we said, the way we handle mental health calls. We researched it across the country with the Mental Health Co-op in a partnership with them, and we really like what Denver did out of all of the country. And so we're working with them. And again, I defer to Mr. Randolph on that, and I'll kind of let him explain it more. But that starts June 28th. And on June 28th, we're going to have clinicians riding with police officers 5 days a week in 2 of our busiest sections, which are precincts, which is Hermitage and North Precinct, and they're responding to mental health calls. And then if there's any downtime, they're going to be doing proactive work in the sense of looking out and where they've seen people that maybe aren't checking back in with their clinician or are not following up on things. We're going to go back and make sure and kind of hopefully get ahead of things before they become a problem to where they need the police. Another program we've got going this year is our juvenile diversion. We're working with Judge Calloway in juvenile court, and what we want to do is look at people and kids that have never been in trouble before, and we can counter them. Because what we've found is if you go to juvenile, you're 7 times more likely to go to prison. There's no ifs, ands, or buts about it. So we need to fix that. What we're doing is what we've said is if an officer stops the child, say with a gun at 3 o'clock in the morning, and they have no history, they've never been, if they're on probation or something like that, then we need to take them in so that way the courts can, because they're already plugged in for resources and services with the courts, so we don't want to disrupt that service. But what happens is if we've got a child that's never been involved before, we turn around and take them home. And then we do assessment for them at home. And we talk with the parents and everybody else or whoever might be there, whoever the caretaker is, kind of see what's going on. And then that's turned back in. And then we get with a wraparound service provider, which they're still working through the selection part of that. And they're the ones that are going to help find the child the best services so that we can save them and change that life trajectory. And the example I give everybody of how important this is the homicide that happened earlier this year that involved a young man that was, I think, one of the top 10 basketball recruits in the state, had never been in trouble before in his life. Clean record. His mom said from the time he was involved with a certain person until the murder, he had 6 runaway reports. Now, regrettably, there's no follow-up mechanism for that right now. With our juvenile diversion program, there will be. And the reason I say this, he went from never being in trouble to committing a homicide in 6 months. We as a society missed that. That's on us as a society for not doing a better job, because that shouldn't happen. You shouldn't have a kid that's never been in trouble committing a homicide 6 months later, and there's no indicator or anything that's there. There were some. And what we're doing is we're setting things in place now between our SROs, who are now, they've been moved part of that organizational excellence. We moved the SRO program away from patrol and we put them with youth services. Youth services has a counseling section, again, part of that interpersonal services branch. And we're tying that in with SROs. They've never been involved in discipline anyway. We are not the disciplinaries of schools. We are there for the safety of children and as an outreach. And we're going to start following that up. And I give the example of the young man that committed the homicide. Had we had it set up then, what happens now is we recognize the fact that he's had 2 runaways, never been in trouble. You get with the SRO and you say, hey, what's going on with this kid? Check into the schools. They find out, is he still going to school? Is he skipping school? Is there somebody different? Is there a new friend group? Is there something that's happened? And then we start working from there to get them plugged into services so that way we never have what happened happen. We can't lose a life like that. Every child is vastly important. Every life is vastly important. And I'll be very upfront with y'all. I appreciate that more so than in the past, people are recognizing some of the pandemics we have within the fact that 80% of our shooting victims are minorities. 80% of our suspects in shootings are minorities. And forever it was ignored. And I don't want to say I'm proud, but I'm thankful that there was some outrage from just the general society when the 3-year-old was murdered. Because we've had that happen before in the past, and it was a blip in the radar on the news. And so that's why it's so important that we coordinate with our service providers, with activists, with everyone, so that we're all on the same page about what's important. Again, going back to what the department's doing, we've realigned it. We're doing the juvenile diversion. We're doing the mental health co-op. We also have an adult group violence intervention. If you're familiar with it, Oakland's done it really successful. There's been some others that have done it around the country. And what they do is that those people that you know are your problem shooters, the ones that are involved in shooting after shooting after shooting, in robberies and carjackings, the most violent people, that's who you want to address. And the way we do it is initially either with prosecution, and then once they recognize the fact that they will go to jail for those crimes, then you can do a call-in. And it's an amazing thing. What happens is you have a community advocate. In this case, it would be Ron Johnson, who's been hired by the mayor's office. And if you haven't met Ron, he is an amazing man with a passion for helping people. And I'm so elated that the mayor's office has him on board, and that's who we get to work with in that regard. So Ron works with our inspector that's over alternative policing, which is Inspector David Imhoff. They combine and come up with a solution where when we get them, we say, hey, look, we want to change your life. We know you've been gangbanging. We know you've been shooting. We know you've been doing all this stuff. So we're going to offer you the opportunity to call in where you come in and you meet with people like Ron. And they have advisors that have been in that lifestyle and have gotten out. And then we provide housing, health care, mental health care if it's needed, food stamps, whatever it might be, job training, a job. Because you can't say, hey, we want you to get out of this life without offering you an alternative that makes sense. And that's where the mayor's office has been great in assigning Ron to that. And that's part of our group violence intervention. Now, that probably won't roll out until the end of this year, maybe a little sooner, depending. It's more about the mayor's office being able to align those resources together. And it's a tough one. I mean, because you can't have the police do that part. It doesn't make sense. And what they've found elsewhere is it doesn't work.
Thank you,
But
Deputy Chief Taylor. I
Chris,
want
ma'am,
to
Chris is fine.
thank you. I want you to do in a minute or two something for me. I love all the
The
programs that
money
you've
part,
highlighted. The money part,
yeah,
which is
glad.
the core of the
Honestly,
conversation.
yeah. Our budget, the biggest increase for our budget since they're opening the ninth precinct, that won't be for about 2 or 3 years. Well, what happens is you need 130 sworn people to open a precinct, 130 sworn and one civilian. Well, there's no way the city can afford to hire 130 officers this year. We recognize that. But you also can't wait until the precinct's open in 3 years and say, hey, we're going to hire 130 then, because remember, it takes us 6 months to get them through the academy. We have one of the longest academies in the country. Very proud of the quality and the level of training we put our officers through. And then they have an additional 6 months where they ride with a training officer. So it's an entire year of training they receive before they're allowed to go on the streets by themselves. And even then, we check on them a lot afterwards. We've instituted a mentoring program and a lot of things to make sure our officers are doing a great job and that they have the resources if they hit something that makes it hard for them. So the big part of that is they've added 40 officers this year. And the reason being is they're going to tier the additional officers for the precinct with the idea that we order 40 this year. Hopefully we order 40 or 50 next year, and then you'll have to do another 40 or 50 that third year. And we'll be a little behind by the third year, but we recognize the fact that it's an expensive proposition to open the ninth precinct. It's what the council has wanted. They've appropriated the money for it. So we've got to fill the bodies in there and put them in. And honestly, we're pretty behind in our staffing. Memphis has 2,000 officers. We've got 1,500. And there's not that big a difference in the size and the call volume because Memphis also has a sheriff's department, which does law enforcement too. So that's a big part of the budget increase. Another part, honestly, our budget increased right at about 5% compared to last year. And the biggest part of it, other than the additional 40 officers, is the fact that the new pay plan that's coming in for all Metro employees. I give you an example. Reinstituting the longevity check, which was taken away from all Metro employees last year, is right at $1 million for the police department. So when you say, what are we increasing our budget by? Realistically, we haven't done anything as far as improvements. We had some additional money that had to be spent for body cameras, which we knew was coming. That was coming up this year. There's some money that's being spent for some IT issues related to body cameras where we have to make sure the download's done, and we had to hire some additional people to do the audits. And honestly, those bodies weren't given to us until this year. So we've been doing body cameras, and I'm excited about body cameras. Will go in everywhere. Will be July 13th.
All right. So the main of all right. I want to, because this is and I'm glad that I extended the time for an hour and a half. But I want to make sure that we touch all aspects of our conversation and that allow my other panelists to chime in as well.
Yes,
because
ma'am.
I can see you're very passionate about this, and there's a whole lot, and I'm happy with all that you're putting in. Now, one thing that I'm going to say is this, and there is a question that came in. And I want you to address it in the meantime, but please do it like in 1 minute or so. You are restructuring, you're trying to do things differently. I read where it says that the police would not be going for every car crash anymore. Shouldn't there be cost savings in all of that? I mean, why does it have to be increased cost? Why are those not resulting in places where you can cut? If you
Yes,
can
no.
address that, and it's coming. I'm rephrasing a question from Ms. Knox that says, is it possible for the cost of public safety be too high? And so why can we not reimagine all this thing that we want to do, but save costs in the process? And so if you can just,
We are,
again, I don't want to take, yes,
no,
sir.
no, you're fine. You're fine, man. Actually, as far as the traffic accidents, that's one that the ECC started a little bit. We weren't prepared with the right report, but you're right. We actually are looking at a vendor that will provide free reporting for us. And what happens is it's about 20,000 accidents a year. There's 30,000 accidents, but there's about 20,000 will be applicable where nobody's hurt, the car's not immobile, where you can move your cars. And the idea is that way you're not waiting 3 hours for a police officer, because to be quite frank, even though we can move that to a semi-automated system, officers are still going to have to respond where people are hurt. Officers are still going to have to respond where the cars aren't movable. where there might be a DUI, where someone tries to
Yeah.
leave, where people are getting in fights. So there's quite a few calls that we still have to respond to, and they actually
So,
take quite a
so
bit of
there's
time.
no,
Yeah.
we've not identified any cost savings there. So thank you. I'm gonna come back to
Oh
you
no,
based
there's
on the
okay.
questions that people are asking, but I want to move forward. I want Mr. Randolph with MHC, and I know that Deputy Chief Chris has talked a lot about that mental health component, and so it's taking a little bit of your time. And so, can you please, in about 3 to 4 minutes, just talk to us about that partnership. And again, I want to, because I'm looking at the time here, there's still so much to be said, and I want to make sure that the we have the people's budget have ample time to be able to share their thoughts as well as our other panelists. So if you can just tell us briefly what that is about, I think that would be great. Thank you.
Yes, ma'am. Thank you, Councilwoman, for having me. My name is Michael Randolph. I'm the Crisis Program Manager with Mental Health Cooperative. I'm also a licensed professional counselor. Uh, Currently, Mental Health Cooperative is the state designated crisis provider for Davidson County. Currently, our mental health crisis response in Davidson County is our mobile crisis team plus treatment, our treatment side, where we have 32 treatment beds where anybody who comes into our services never gets a bill. And our mobile crisis, we run a 24/7 mental health crisis line. We get calls from the community, people in crisis, families, law enforcement who are experiencing someone in a crisis, and hospitals. We assess primarily people who are uninsured or have Medicaid, but we also see any insurance depending on the level of the crisis and who's involved. Um, our master's level clinicians will go out and do a crisis assessment, and we like to meet the person where they're at. Try to connect them with resources to help them. Sometimes that means they stay at home. We connect them with an appointment, things of that nature. Sometimes they come in, they go to treatment. Sometimes they go to a psychiatric hospital. Our crisis co-response program, and I'm just excited people are talking about mental health crisis response. I'm very passionate. I've worked in mental health crisis and mental health cooperative for 12 and a half years. Um, Overview, the co-response program is embedding mental health professionals in police precincts. And the primary mission of the co-response program is to improve outcome, streamline services, and create efficiencies for people experiencing a behavioral health issues who come to the attention of the criminal justice system. Um, we're going to use a holistic approach, wraparound approach for people who may be in acute crisis to connecting them to long-term community supports and resources to get them help. We're going to build upon the elements of best practices of trauma-informed service delivery, which is trustworthiness, safety, choice, collaboration, and empowerment. Um, we are going to provide crisis response to generate solution-focused outcomes for each individual, and we will evaluate persons who may pose a danger to themselves, others, or to community well-being. Generally, before, if you called our crisis line, we would define a crisis as someone who is experiencing some suicidal thoughts, homicidal thoughts, maybe experiencing psychosis, or is unable to care for themselves due to mental illness. And really, we're trying to just get people the best help they can. And when it comes to the mental health system, from top to bottom, it needs improvement. It needs more programs. We need more inpatient beds. We need more outpatient services. We need more therapists. We need diversity. We need, you name it, we need it. I'm really excited that people are very passionate about this topic this year, and they're wanting to improve services to the community. And like I said, we looked around at different cities to see how everyone else was handling mental health crisis response, how are they improving services, what kind of programs they had. Denver is a city similar to size to us, similar kind of crisis problems. They have a robust crisis response system with a number of different programs. I look at their city and they actually have great funding sources and things of that nature, but they have a lot of programs, and I look at it as like as a goal for us to move forward to. But a big part of the program is crisis intervention teams, which is officers who get 40 hours of very intensive training about how to respond to mental health crises and how to verbally de-escalate. Because no matter how many pilot programs we launch, there's always going to be times like overnights, things like that, where first responders, be it firefighter or police, are going to answer calls, and mental health crises might be a factor in those calls. So even with having embedded clinicians or a number of other programs, well, having officers highly trained on how to de-escalate will be good for the community. And I know that we have wanted CIT in Nashville for many years, and Chief Drake is very dedicated to training officers in that. So the first training starts on Monday with the officers involved with the pilot program. Volunteer officers from North and Hermitage will be getting the 40-hour training next week. And the co-responders will ride along with these specially trained officers to primarily respond to mental health calls for service, but also to respond to any other things in the community that they need, and that a mental health approach might be better for the individual being served. And also, we have a follow-up specialist on the team who has a lot of time set aside to just do intensive follow-up of individuals we come in contact with and get them connected to mental health services when a co-responder sees someone who may need mental health services but doesn't have it. And our primary goal is to reduce criminal justice contacts for anyone with behavioral health issues or severe and persistent mental illness.
Thank you. Thank you. I will come back to you. And for our panelists, I'm checking online to see if there were any questions. There's no questions yet. I'm looking at all of my phone. When you see me put my head down, I'm trying to check all of my phone to see if anything has been texted. So people don't have questions yet, but that doesn't mean that they will not. They may be waiting until they've heard from everyone. I will have a question for on the mental health later, but I want to get through the presentation part of it itself because we are actually running behind. But I want Miss Didi Murphy and Mr. Andrew Crinks from the People's Budget Coalition to speak to us about your take on, you heard what MMPD has to say. I know that the People's Budget is a coalition of many organizations, and I know that you guys have done a study, you put together a presentation, and your take on the cost of public safety, where we are, and where you think we ought to be. I'll give you all the time that you need to be able to do that. If you can do that within 15 to 20 minutes, I think we're not having questions. So we're just having a conversation. And I think that works as well, as much information as you can provide in about 20 minutes.
Great. Thank you, Councilmember. Greetings, everyone. Great to be here. Thanks for the invitation to be part of this. My name is Andrew Crinks, and I am an educator and an organizer, and I work with the Nashville People's Budget Coalition along with Theda Murphy, who will speak after me. So I want to say just a couple things to begin with. First of all, we do have a report that we just put out within the last week, I believe, that I can put a link to in the chat in a little while that you can look at to get a little bit more information than we'll have time to cover today. But I want to kind of start by saying that we formed our coalition, which, like you said, is made up of a number of different organizations. We formed it to talk about dollars and cents, to talk about the details of budgets, to get into the weeds, and to invite community members into that because we believe that they're not invited into that enough as it is. But our work also encompasses more than just the dollars and cents alone. And so I want to spend a few minutes talking about both the dollars and cents, but also kind of some bigger picture stuff. So to begin with, our perspective, and the perspective of a lot of people, is that budgets can be thought of as reflections of the things that we value most. And our assessment is that our city's values are deeply misdirected at the moment. Let me explain a little bit what I mean by that. So we are interested in the level of funding for public safety because we are also, first of all, interested in doing whatever is necessary to help create thoroughly safe and thriving communities beyond the question of spending on police and jails and courts. So we believe people deserve to have what they need to live full lives, and that we should arrange our governmental and social and economic systems towards that end. But what we feel is that the evidence shows that the safest communities are actually not the ones with the most police, they're the ones with the most resources. And when we say resources, we're talking about public goods like quality education, safe and affordable housing, accessible transportation, social services, free and affordable healthcare, parks, rec centers, libraries, first responders and violence interrupters, daycare centers, spaces for art, things like that. So when communities have those kinds of things abundantly, those tend to be the safer communities because they're thriving. So safety depends upon a community being thriving to begin with. And so one of the biggest myths that I think that we've inherited is that the institution of police in the long range up to the present, that they were created and that they exist to actually keep us all safe in the same way and that they do a good job of it. Now, our feeling is that police do not actually create the kind of safety we think that they do because primarily they don't and cannot give the kinds of resources that actually make communities strong and safe, the resources that I just listed. So if the safest communities are the ones with the most resources, then giving more and more and more of our public dollars to police and jails than to almost all public goods combined, which we currently do, that would actually be more of an impediment to safe communities because it uses a larger share of our taxpayer funding to fund responses to our community's problems that contain a threat of violence or force with them, rather than using a larger share of our taxpayer money to address the root causes of why there's problems in our communities to begin with. So to us, it really doesn't make sense to respond to problems of crime and harm that in many cases are arising from centuries of economic and racial inequality. To respond to that by deploying armed agents of the state doesn't make as much sense when you think about it. And it actually doesn't do a lot to resolve or prevent those issues from happening again. Police often turn up after something bad has already happened. And prevention is not so much a part of what the institution does as much as we think it does, I think. And so for us, only by fully funding public goods and more situation appropriate first response can we actually do that. So there's also a myth that we identify that this popular belief that so long as we can put more money into police and jails, that will naturally mean that we'll get more safety as the result. But currently we spend millions and millions more each year on police, and gun violence is currently up by 39% according to the chief. Gun violence is a major problem in our city and we care about it very much. And we actually think that police are not the best people to address that problem in a thoroughgoing, preventative, and long-lasting way. So the other thing that I think is important to point out is that if it were true that more money spent on police and jails actually equaled more increased safety, then the US would be the safest nation in all of human history on the planet. But we know that we're not, and we know that Nashville is not as well. A couple other things before we turn it over to Theda is the really hot topic right now, the notion of the department being stretched really, really thin, which I think relates to the call for a new precinct and more officers and things like that. But some data that is worth looking at, we think, and that we included in our report, is that in terms of calls for service, and this data is accessible to the public on Metro's data website. First of all, a majority of calls for service, the term calls for service is a bit misleading because calls for service can be both officer initiated and resident initiated. And actually the majority of calls for service are officer initiated, is my understanding. Around up to 80% last year of all calls for service were for situations that were not inherently criminal in nature or that were completely unrelated to anything criminal in nature. Likewise, about 99% of all calls for service are for non-violent or situations that are not inherently violent. And then when it comes to what happens after a call or someone comes out, around less than 1% of all calls for service in the last couple of years have resulted in an arrest or citation. And actually calls for service are majorly on the decline, partly because of what Mr. Taylor said about the decrease in traffic stops, but just in general, there are fewer calls for service. And in addition to this, we think about the success of police to do a lot of different things. The police, I think if you even ask a lot of police officers, they will tell you we're asked to do too many things. We're asked to do things that we aren't equipped to do in a lot of cases. And so it's important to note too that in terms of like clearance rates of getting a conviction or of catching the person who did something wrong, when it comes to property crimes, about 1 in 10 of those cases are cleared. And for violent crimes all lumped together, it's about 38%. This is for 2019, the most recent data from the FBI. So to kind of start summing up a bit my portion before I kick it over to Theda, our coalition is focused on police spending because we think public safety is created by other means than just handcuffs, guns, squad cars, jail cells, etc. We think that you create public safety both in the long and short term by giving our communities what they need to thrive. And by definition, police aren't equipped to do that. They show up after something bad has happened and usually don't have what they need to resolve that issue. And just having more officers won't make that possible either, in our opinion. And so the more we entrench ourselves in this approach to public safety, which is much more narrow than the one that we want to invite people to think about, the more we're going to keep on shackling ourselves to so many millions, hundreds of millions of dollars that we could be directing in directions that would actually work to prevent violence and crime in the long run in a more sustainable way and in a way that's more equitable. So I have a timer in front of me and I'm at about 9 minutes, so I'll just spend just a minute wrapping up before I give Theda about 5, if that's okay. A couple of numbers. Again, it's important to name, we think that budgets are reflections of our values, the reflections of the kinds of communities that we want to maintain and build. And so it's important to note then that for our community that we live in now, our budget, for every $100 of the general fund that we spend, 36 of those go to the criminal legal system. About 20 of that goes to the police, whereas we spend about $1 of every 100 on affordable housing and less than $1 of every 100 on social services. MMPD is slotted to get 11.5 million in this next budget cycle if approved, about 4 million or so for 40 new officers, as Representative said, for the Antioch precinct. But we also currently have about 94 unfilled positions in MMPD, which equates to around 9 million if you consider the cost per officer being at around 98,000. I can talk about that math. Yeah, and I think I will leave it at that. The total numbers, we're talking about hundreds of millions, about 400 million for the criminal legal system a year, about 214 in the general fund last year was for police, 225 total if you include all the funds. So the number of dollars that we spend on police compared to the things that we spend that could actually help eliminate and reduce the need for our dependence on police for all the things that people call them for would create for a different approach to public safety. So I will leave it at that, and I will turn it over to Theda to make some further remarks.
Hey, good afternoon, everybody. My name is Theda Murphy, and I am an organizer with the People's Budget Coalition. And I would like to say that my background is in mental health. I have worked for almost 20 years as a crisis counselor. I worked for MMPD in the Victims Intervention Division and in the Domestic Violence Division as a crisis counselor. And then I moved from there and worked for mobile crisis outside of Davidson County. I have also worked for Suicide Crisis Line and the Domestic Violence Line, both as a volunteer and as paid staff. Yeah. In my years of crisis counseling, I think I've done just about every type of crisis counseling there is. So, and as working for mobile crisis, I co-responded with police on crisis calls. And during those calls, it felt like I had two jobs. One was to, of course, respond to the person in crisis, but the other was also to keep the police officer from arresting the person. And that kept me from being really, really as effective as I would like to be in responding to the person in crisis. So because of my experience in doing that, I feel that a co-response model is the wrong choice. And as Andrew was saying, the communities that are most heavily impacted by policing, they never trusted the police. There is no trust, and they are continuously traumatized by the police. And basically what they have is an abusive and codependent relationship with the police. And it's not healthy for those communities, and it's not healthy for the city. the city has disinvested in these communities so much that MMPD really is the only agency that's there. As the only one that's easily accessible, the only one that's there. We don't treat other communities in our city like that. And the people in those communities are very much aware that whenever they ask for something, those services are probably only going to be provided through the police. So I want us to think about all those innovative mental health services that the police are offering. Why can't those services be offered by Metro Social Services or Metro Public Health? These are the agencies that their primary mission is to provide mental health and care for the service for the people in our community who are the most vulnerable. That's their mission. So why can't those services be provided through those agencies? Why do they have to be provided through the police? As I said, we don't treat other communities like this. And we continue to act as if there is not deep trauma in these communities that has been put in there by the police and has not ever been addressed because we don't talk about it honestly. And I feel like this is a really insidious form of gaslighting to the people in those communities. So we need to listen to the community when they're saying they don't want a co-response model. There was a man who was recently in crisis, who was recently killed by MMPD. A few years ago, a woman in crisis was charged with an officer's death. Another woman in crisis was recently shot at. So are we going to continue to pretend that people in these communities and these entire communities are not being traumatized and re-traumatized by MMPD?
Councilwoman, I thought we were going to discuss the budget. I didn't realize we were villainizing the police at this moment. And I would just ask that you kind of keep us on track there.
Thank you, Officer Taylor. I think that just like we were able to talk about programs that the police is putting in place and talk extensively about the program, I will allow People Coalition to talk about what they think. But I will say that again, let's not do the vilification. Let's try to keep it to the points that we want to make, Miss Leader. But do express your thoughts, because we did do that in the beginning as well. It was not just our numbers. And so we cannot talk about responses by numbers only, which was evident in the police budget.
I love the idea of hearing their programs. I would love to hear their programs, specifics of how they're going to do it. I'm not really sure where they haven't said yet what they're going to do. And we're on full support. Renee Pratt with Social Services is one of the most amazing people you will ever meet.
If you will allow me to speak, I was just about to get to that.
Okay, please do.
All right. This is why, and again, look, there's passion here. And like I said, we all want to do what is best for our residents, and I appreciate that. And if you all please allow me to moderate, like I said, if you have a question for someone who is speaking, put it in the chat or text me about it, and we'll cover it. I want us to do that. If we go back and forth, some of the other people will not be able to speak, and we may not be able to take audience question. I'm writing down notes as everyone is speaking, and I do have follow-up questions to everyone. And so please, I will cover all of that. But Ms. Murphy, let's keep it to the programming and what we feel should be funded or not funded as the conversation continues.
So back to what I was saying, I also feel like what I just said needs to be said, because as we are making policy decisions, we need to think about the people who are impacted, and we're not including them in these conversations. So we're not getting that perspective. So I was not vilifying the police. I was explaining another viewpoint. I worked for the police, so, and I met many good officers while I worked there. So this is not about individual officers or their intent. This is about systems. So what I was going to say is that I feel like a cahoots type model is something that could work here in Nashville. But it has to be done with the full participation of the people in the most impacted communities. And that's not happening right now. Those people have no idea what's going on. They haven't been asked what type of crisis response they want. They have not had any input in how it will be implemented. And they need to be included now, before something is set in stone and is in place. Otherwise, what we end up doing will just perpetuate the status quo. So thank you for giving me a platform.
Thank you. Thank you. I want to go to Ms. Armstrong, but before I do, I do want to put a question out there. One will be to Chief Taylor, and then to Andrew or Ms. Murphy. And the question is around that mental health provision. I think we've said a lot about it. Now, Deputy Chief Taylor, in a minute or so, tell me, Ms. Murphy made a point that this mental health crisis, it's good that the police department wants to get into this and want to do. Why is it that the program has to be inside the police department? Why can it not be done through social services? That would be your question. For Andrew, you'd said during your presentation, Ms. Murphy, something interesting about officer-initiated calls being at 80%. What is that? Can you define that for folks so that at least we understand what that term means? But if you would, Deputy Chief Taylor, we're all talking mental health here. And I think that from what I'm hearing, it's an important thing that we want to do. MMPD wants to do it too. So everybody is saying mental
Absolutely.
health is the way to go. But the question on the table is, if we have agencies that are set up to deal with this type of thing, why does it have to be housed in MMPD or be an MMPD initiated process?
Yes, and that's a great question, and I appreciate it. Really, the calls for service we're talking about are ones where people are in deep crisis. And I'm not going to pretend to try and explain that. I'll defer that to Michael and everybody else on the panel. Y'all are much better experts in it than I am. But what we're talking about are people that are really, really in those life crisis moments, suicides, people threatening to hurt other people. It's not there's a whole scope of mental health that we don't need to be any part of. And we recognize that. In fact, the second phase of the Denver program, where they're really robust, is they have clinicians and EMTs that do the public outreach, and they only take the police on the ones they really think are kind of dangerous, but they start doing an outreach with the homeless community in some different areas to, people that are truly underserved. We recognize that. It's just, we have to start it as a pilot program. So what we're doing is we're somewhere we can very easily measure it with the health department involved with, and I defer to Michael on the kind of academic part of it, but we're just saying these are the most serious situations where cahoots wouldn't go to. Cahoots doesn't respond to calls of people with a gun trying to kill themselves or hurt other people. I mean, I don't disagree. I think there's a role for both. It's just right now we're doing the part we can do, and then we kind of defer to other people.
So if I'm hearing correctly, you were saying that we want to do with the co-op program with MHC for the really, really serious, where we think there's a danger involved and threat involved. But there is room to have another model. I'm saying this for the sake of my colleagues and the people out there that are listening, that it doesn't have to be one or the other. Because if mental health is a big thing and there's so many ways to deal with it, if the police are dealing with extreme cases, then there is room to have social workers and the social department and social services to deal with non-extreme violence cases. Is that what I'm hearing? Is that a good way to put it to both sides?
Yes, Council.
Absolutely, man. I think we have to have everybody. Go ahead, Michael.
I can speak to this, which is why I like Denver. I think everyone is absolutely correct on this. And when it comes to mental health in general and mental health crisis response specifically, there one solution is not going to do it. And when it comes to that, it's not either or, it's yes and. Like co-response, yes, and a cahoots model, or cahoots model and yes and co-response. I think to very much meet the needs of our city, we need a lot of programs, more than just co-response and a cahoots model. When it comes to mobile crisis, suicidal, the things that the traditional mobile crisis calls, about 20% usually have a weapon involved, or suicide with a plan with an extreme means, things of that nature, where counselor safety and where in those situations that people have mentioned, where they are armed and it's an extreme crisis, an extreme acute mental health crisis, to get
So,
clinicians on
Michael,
scene.
I don't want to cut you off, but there is something that Miss Murphy mentioned, that there are situations where she's gone out, and you have the officer escalating the situation. So, would these officers have the training? I mean, because she's saying where the co-op does not work as well as we think it does. And so, would you say something about that? Then I want to give her and Andrew to be able to address that, because we're talking about something that is very important.
Of course. So with the 20% of calls where there might be a weapon involved, those acute crises, not only would you have a co-responder on scene with those officers would be CIT trained officers, critical incident training, the crisis intervention team with the 40-hour training. If unfortunately with that 20%, it seems to be that officers would be involved. So like I watched with Denver, they went out and rode along with cahoots. They had a call with a man with a box cutter barricaded in his bathroom, where cahoots was involved, but they had to pass it over to law enforcement to get him out of the bathroom. Have a clinician with them to help those high acuity de-escalations, get them to where we can get them away from the criminal justice system, away from police as safely as possible. And I think both programs are needed in Nashville. Co-response, I mean, if we're concerned about the sanctity of life and trying those high acuity situations, start with the co-response model and then add to a robust system with more than just those two programs.
So, Miss Murphy, in a situation wherein mental health counselor goes out to someone, do you see a need in any case for officers to be involved in any of that? Do you see a need for both the co-op and then just a program like the EELS? What is your take on that? And then Andrew, I know that I'm ignoring my other two panelists, but I do know that I will want their take on this mental health, especially Dr. Ildred, on this mental health conversation as well. But since we got here, I wanted to not leave it. Again, I'm looking online to see if anyone has questions. It seems as if people are just interested in what you all have to say. And so that's why I'm jumping in and trying to direct the conversation. So, Ms. Murphy, yes, there are situations when we're sending a mental health person, but it's a very big crisis. Somebody wants to kill someone. Is there a need for a police there in some of those instances? Can we agree that we could have two different options, or it just doesn't work? Is that your experience? If you can speak to that for a minute, and then I want Andrew to talk about the officer initiated calls for 1 minute. I need to go to Dr. Ildred and Miss Armstrong in this conversation, because they are the community members, and I want them to speak to what they feel about this.
Yes, my experience in going on calls with officers, as I was saying, about having to de-escalate the officer, it's because that as the mental health clinician on the scene, I would lose control of the situation if the officer decided to step in. And it was not my call to make. It was not my call to make. If they decided they wanted to, that person needed to be arrested, they would step in and arrest that person. And I feel that it is important that we talk honestly about the trauma in the community, about having an officer present, because that will affect what happens on calls. And if we are developing these models without taking that into consideration, then we are not we can't truly design a program that addresses what people are doing, because things will be happening on calls that we haven't accounted for. The presence of an officer for many people in the community is escalating. And the clinician needs to be able to remain in control of the situation and determine and be the one who determines if the situation has gotten dangerous or not.
So, Michael, is that what happens in a co-op situation? Who makes the final decision? Is that the officer or the clinician?
It is a partnership. When it comes to issues of safety, the calls will be triaged. If there's a weapon involved, the officer's in charge of safety. If there are any, like in Denver, only 2% of any of the contacts they have, and I believe they had, now some of these, I'm a very short notice panelist, so I don't have all my numbers in front of me. Like they did 1,500 to 2,000 contacts, I believe last year. Only 2% were arrested or ticketed. With our program in Nashville, there's a lot of serious dedication to making this work on both sides. When I train the officers, and I'm also training the clinicians who are regular mobile crisis counselors who want to do this kind of work. Is that if we see an outcome where we think the police did wrong to an individual in the community, we will be bringing that up, and we will be fighting and advocating for that person, that consumer, that person with a mental health crisis that in that community. And MNPD leadership has pretty much assured me that we are going to iron out any of those issues with those, if it's down to the individual officer or systems issues. But the primary goal of the co-response is to get the person treatment, not to take them into custody, to get them arrested. The purpose is to divert them. And she's absolutely right with deep community trauma. I don't like that some people have weapons when they're in a mental health crisis. I don't want to go with police to every call. I want the best for the community. I think both programs are necessary, and we just want to help as many people as possible.
We've done a lot of this mental health, and I think we should continue the conversation. And I will recommend that this is something that we need to bring everybody to the table as we're designing what this. I think some of this will be procedural and all of that. I'm not mental health, but what I hear here is that there are things that we need to do, that we need to be sure of, and we need to take the community, the trauma of seeing the police. We cannot disregard it if it factors into how somebody will respond. And if that will escalate it, then we need to look into how do we train the officer in this situation, or what do we do to de-escalate it, so that we're trying to help, we don't make it worse. And I think that's a critical factor that I think we need to bring in. I'm going to jump into Miss Randolph because I do want her and Miss Hildre to. I know they've been listening to all of this. I think we all agreed on mental health. That's what I'm hearing. Now let's go to the number of police. Let's go to the princess that we're adding. And so, Miss Randolph, I know you live in Antioch, and I know that part of the conversation in the community is we keep adding more police, we keep adding more police, and more police does not make us safe. And that is an area that is added to this budget that we really don't need to add. So I wanted to bring you into the conversation and have you speak to that in your own opinion. What you think we need to do. More policing does not keep us safe, I've heard, but we do need more police, I've also heard. Where are you on that? And listening into the two sides, to MNPD and to the people's budget, if you have anything you want to add to that or chime in about that, I would like to have your remarks at this point.
Yeah, no problem. And just to confirm, you're asking me, Mrs. Armstrong, not Michael, correct?
Mrs. Armstrong.
Okay. I just wanted to confirm.
I forgot we have to. Yes, Mrs. Armstrong.
No problem. I am not associated with either party. So I think it's important to kind of put that out there. I am only a member of the community. I have been in the Antioch community for over 15 years. My husband and his parents have been in this exact community since 1996. And so it's important to kind of understand that we are heavily ingrained in the Antioch community. We love where we are, but we do advocate for a precinct, and we have advocated since I have been there. Again, like I said, I'm not on either side, but it's no secret that if you look on our Nextdoor apps or on our Ring apps, which our community uses, we are literally every day, all day talking about the drag racing and the helicopters and the amount of excessive speeding and reckless driving that happen in the Antioch community. And when that happens, myself and my counterparts are going to call the police. And so I don't want to shun any other organization, but the organization that I'm going to reach out to is MNPD and my local council people. And so those are the people that are going to hear my complaints, my concerns. I am going to share the videos, which is another thing that we have kind of gone to in the community where the reckless driving has gotten so intense that our passengers in our cars are recording these cars that are weaving in and out of traffic, that are going into oncoming traffic, that are using the turn lanes as if it's a right of way to kind of beat the traffic. And we share that with MNPD. And I have to say that they have been graciously accepting in those videos. They have expressed, Christy, be safe when you're recording those. And so I have to express that, hey, it wasn't me, it was a passenger. But they have been receptive to that. And every night, as someone that has insomnia, listening to the drag racing from sunset to sunrise is exhausting. And I do believe that it is because there is a lack of presence of police in our area. And it's no fault, I think, of the police. They are stretched very thin. I could not do the job, so I don't want to say that I could. But I could go a week, and I'm not shunning them, but I literally could go a week without seeing a policeman in our area if they weren't dispatched. And after I share those videos of the driving, of the excessive speeding, and of the drag racing, then we'll see, additional patrols of, motorcycle police on Murfreesboro Pike, trying to contain that complaint. And so, again, like I said, I'm not on either side, but MNPD is the resource that I'm going to reach out to. We try to kind of reach out to our council people and they listen to our complaints and they also share that with the local police people for our precinct. In the area that I'm in the Nashville Woods area, so right off the golf course there. Our precinct is Hermitage. And so by the time I call, there's about 25 minutes before they can even get to that area. And so the actual people that are actually doing things that concern me actually know that. They know that Hermitage is going to be who's dispatched to the area because I've called from that site. On the other hand, I do believe that it does take both the police, the local, constituents in the community and other divisions, other companies to work as a partnership to kind of curtail any negative connotations that come from policing. I try to be one of those people that follow everything. And so I've actually seen where MNPD is going into some of those communities where there may be a negative connotation of the police presence. And so I've seen where they'll go and they'll send, they'll take ice cream to kind of share with the kids. And I feel like that's any other prejudice where we have to kind of work to break down those barriers. And as someone, my husband is a very large, over 6 foot Black man, and he could fit any kind of, bias that's put out there. And I can actually say that, he has a very good relationship with police. We have 6 children, ranging in age from 25 down to 11. And the current climate for police in the actual environment that we're in right now is very concerning for me. But when I've needed the police, it's been a very positive interaction for myself. But I do want to make sure that I'm not glossing over any individual that has a negative interaction. The precinct is something that I have advocated for, and I'm probably going to continue to advocate it for because it directly affects me, our property, because we are homeowners in that area, and we have been for nearly 2 decades.
Thank you for your thoughts. In your comments, you talk about the drag racing and the trafficking. The police just said they would not be coming out for traffic stuff anymore. So would there be an alternative to that? Are there other reasons? And I don't have the statistics, and I don't live in Southeast, but I know that a lot of people in Southeast want the precinct, and I'm sure they want it for a whole lot of other reasons. But I guess my question is this: that if we're talking about, and I'm playing the devil advocate on our side, does it really have to be the police? If it's not, if it's just for traffic stuff, when people are saying that some people have a trauma when they see a lot of police in the area, could there not be an alternative, or should it have to be a precinct and a police presence? In your opinion, just speaking for yourself.
In my opinion, and I do have to say, I was rear-ended a few months ago, and it was 3 hours for the police to respond No one was hurt. My car was drivable at 15 miles an hour, but it was drivable to our home. But the issues that I have, the excessive speeding, I don't think that's something that I could police. Because if I were to kind of get involved in that, then the police would be dispatched because then, that's a hostile interaction between two civilians. And so the instances that I speak of where it's excessive speeding, I mean, I don't want to shake a stick at it, but it's easy. People can go 70 miles per hour on Murfreesboro Pike. They will weave in and out of traffic, and traffic lights are suggestions. They are not rules on Murfreesboro Pike. And so those instances to me should be policed by MNPD and not by the local civilians or any other institution. And that's just my opinion. Like I said, I'm not a subject matter expert, but that's just what I've seen.
No, thank you. You are an expert because you're a resident in the community. And I think that oftentimes when we talk about the people, I want to make sure that we bring in, all those voices into the conversation. They are diverse voices. And as someone who represents all of the county, I want to make sure that I'm listening to everyone. And I think that, in my opinion, we get to a better place when we look at every side and look at, what works and how do we get there. And taking everyone's opinion into consideration. So thank you so much for your thoughts. Somebody did make a comment, there's no question, but somebody did say that next door has been very problematic for many Black people. I don't know what that means, but again, maybe in some area or the other, but I wanted to just read that out because that was a comment that someone put and I wanted to share with all of you. So I want to go to and I'm looking the chat room. You guys don't have any question for each other, so I'm moving right along. And it's been a good conversation back and forth. Dr. Hildreth, I want to bring you in into this conversation, and I want to bring you in towards the end because I know that you have a wealth of experience and you're so ingrained in the community on all sides. And I just want your thoughts on public safety in Nashville as a member of the community, as a part of the COB, as part of the 372A Commission, as part of, you were with Limscomb for a long time, you're with American Baptist, so you've touched a lot of people in the community. I want your thoughts and I want your take and I want you to just chime in also, not just what you thought, but also in the conversation that we've been having so far. I really would like you to hear where you think we are and what you think we need to be looking at moving forward. And thanks for your patience.
No, thank you, Council Member Suara. Thank you for convening this forum, for making the workings of our government and governance accessible to the people who are actually the governing force, right? So you are providing a tremendous public service by creating this space for conversation and also education. So I will try to keep my remarks brief and focused and in that spirit. And while I am pleased and honored to be the member of many communities, residential, professional, I was formerly a public defender in Maryland, and I was also a warden in juvenile justice in Maryland, right? And so I sit on the COB with members of community and also with former law enforcement officers, right? Our oldest child is a current active duty member of the United States Army and has been so for 14 years and has served in harm's way. So there are several ways, but I'm married to a Black man. I'm the mother of a young Black man, and I also worry about them and thinking about Sandra Bland, my daughter, and sometimes myself. So all of these are the identities we sit with. That said, I'm going to focus my remarks to you, council member, and your colleagues, because you have some decisions to make in this budget process. And so I want to think in that way. Also, I'm going to hit enter on both Facebook and over here on Zoom. So I have my personal information contact link to the COB website and also to the zip code 37208 work that you have mentioned and that council has been moving forward. And finally, as a disclaimer, I'm going to ask the member audience to please forgive me for looking at the side of my head and profile for a moment. I'm looking at another computer where I have the remarks so that I don't miss anything. You asked us to come here and think about public safety. And so listening to what has already been said, it really picks up themes that I was prepared to ask. And that is, how does a community define public safety? And one of the things we have to be aware of is community is complex. We are several communities. You have voices from representatives on this call, but I don't think we're hearing from our community members in zip code 37211. What I think of is, Nolansville Road and the International. So now we're bringing in language and culture into that. How do all of our communities define public safety? Is it when members enjoy public and shared sense of security, well-being, and the ability to exercise collective agency, what we do together, free of harm, harassment, or repression? And Andrew Crinks did a beautiful job of listing all of those things where we feel safe when we do that. So when we think about that, and we think about we're having a budget discussion, my question around public budgeting to you and your 39 colleagues is, how does a budget reflect your constituents' sense of true safety in a public life, right? So what have the communities I am of and work for told us about public safety as its priorities? I would say very specifically, one of the things that the community did through the elective process was to vote to create a community oversight board in November of 2018. And so I'm a member of that board. We have been working diligently for 2.5 years, and we're at a point right now where when we're talking about funding public safety, I think there are some things in that charge that maybe have price tags, where I'm going to ask the question to you and through you, are those measures fully funded? So for example, what do I mean? Article 11 of the Metropolitan Code, and you can find this in the link that I dropped in the separate chats, right? So section 11.1302, powers and duties. It says that the board, COB, is going to have the following powers and duties, and that includes the board shall have the power to investigate allegations that MMPD officers have committed misconduct against members of the public, as well as issue policy, advisory, and resolution reports and recommendations to agencies involved in public safety. And also that the board has the power and duty to have the option of establishing a monitoring program. If we stay with those three things, to issue policy advisories, we as a board have issued a number of policy advisories, and the most recent one that was publicly discussed at our public meeting on May 26th, the recording of which is available through that website. We talked about, I guess it's a draft report because I wasn't able to find the final link on it, but the NAACP asked us to look into hiring practices for police officers. And there is a 40-page report that I think is moving out of draft right now with 11 recommendations. A couple of those recommendations, for example, include recommendation number 3. MMPD should evaluate reasons for civil service testing no-shows through surveys and interviews with individuals who did not show up for testing, and it goes on. Council member, you are a fiscal professionally, right? So I think that you understand that the minute we have a thou shalt, well, that investigation and identifying and publishing report is probably time and money, right? So one of the questions we're going to have is, does the current budget sufficiently fund the police department to respond to these recommendations? Or will they turn around and correctly say, that's real nice, but we don't have the money to do it, so we can't? We have an opportunity here, sitting with you and your 39 colleagues, to make sure that that doesn't happen. So something like looking into the civil service testing protocols. Number 6, MMPD should review at least annually the demographics of applicants that have been assigned to background investigators and the number of disqualifications resulting from each investigator to identify prudential biases, and on and on. We're getting in the weeds, but once again, what? There's administrative work that COB, under its mandate, has made a recommendation for. If that recommendation is accepted, it will probably take time and money to do. And that will be on the MMPD side of the ledger. Are we fully funding them to do that? Because if we don't fund that, then we don't fund the people's statement about how they feel safe to have appropriate oversight. So I think I'm making the point there, and right, so I'll move back from that. The other things that I think about my process observations for today is, how do we continue to ask? You've done that of panelists a little bit, but what are the specific recommendations? Yes, we have talked about mental health, but what are the specific programs and what are the specific alternatives? And so I wrote some of these notes on my cheat sheet as I was listening to you all, right? Thinking about this, public safety seems to have a sharp correlation with public trauma and how we recover from that. If gun violence results in community trauma, then that means your entire community, council member, is traumatized every time a firearm is discharged, whether that firearm was public or private, right? So that means that the more guns we have on the street, the more trauma and risk of trauma we are likely to have. And it's not just crisis intervention. It is not just a mobile unit with 32 beds, because I am sure Mr. Randolph is going to be able to say that trauma lives on in that body and in generations to come. And that's why we have significant funding in ACEs, adverse childhood experiences or adverse community environments, right? That's long-term and long-acting. So when we think about increasing 130 sworn officers with firearms on the street, we have to think about the per se possibility and probability that guns will go off and persons will be traumatized, whether they're wearing the blue uniform or they are members of the various communities. And everybody is going to need trauma care. And so that means that the point that Ms. Murphy made that I think cannot go silent is, are we funding the public entities that are designed, equipped, and commissioned to provide these services? So have we fully funded you and your 39 colleagues? Are you satisfied that the public health budget, mental health funding, any place else, health officers in schools, is everybody funded for trauma? Because if not, that's a public safety concern. But then I also want to say that your community-based providers are also a part of that triumvirate. And is the council prepared to guarantee that there will be public funding available for alternative organizations within the different communities and zip codes? Antioch can do it the way it needs to be done. I'm sitting here in 37208. We can have our response. Green Hills can do what it needs to do. And we can also make sure that 37211, where now we're going to have language and culture and all those other things, are those trauma responses done? So I think that I jumped around on my page a little bit, but that was pretty much where I wanted to go and then my last thought was process, not just for this year, but going forward. I don't envy you and your colleagues the decision you have to make about whether you're going to fully fund the 130 new officers or not. What I do know is this: we probably need to have a civic shared understanding of what the right balance of funding is. So what are the indices that you're going to advocate for and support? Is it every time? I think I heard the deputy chief mention that Nashville has 1,500 officers, and I did the quick math, and we have 10 staff in COB that were authorized. So if we get 130, that's almost 150. That almost means that the COB budget needs to be increased by one new FTE. And that wasn't on our radar. We were grateful that our executive director at last week's meeting indicated that our budget request was fully funded. But what if we didn't ask for enough? Because the entity that we are deputized to supervise, right, and hold accountable has now grown. So now we're out of kilter. Probably, as I close, a more interesting index is going to be, what if for every officer that's hired, there needs to be hired and fully funded a mental health professional in any one of those locations, either in our local government or in the community-based services? Index funding. So you have as many police officers if you want, if that's what you all choose to do, as long as you have also provided for the folk who will respond to the risk, trauma, and unintended consequences that may obtain. So those are just my structural thoughts, and I hope that that's been clear and a little bit helpful. Thank you.
Wow. Wow. Thank you all so very much. This has been a good informational session for me. And as I listen to all of you, and I'll give everyone a minute to wrap up. I'll start with Officer Armstrong, Deputy Chief Armstrong, Deputy Chief Taylor. See, I've been here long enough. Deputy Chief Taylor, to just have some closing remarks. What I'm hearing from where I'm sitting here is that no one said, I think everybody said we need public safety. But what I hear is public safety is very involving. Public safety is not just policing. Public safety is every other thing that adds to our constituent feeling safe. I heard Dr. Idre talking about even within our policing, do we need to add money to some part of their program to make their public policy more effective? I hear about what do we do with affordable housing and schools and things that had to public safety. And I think that's what I'm hearing. And I think that's part of the challenge that Dr. Idre threw out there to my colleagues and her, to be able to say that, do we need to rethink, not just in the dollar amount only, but in terms of the efficiency and the allocation and the policies that we're talking about. I will
Jazz, I got kicked off.
yeah.
Councilwoman, I apologize. I got booted off there for a second.
It's okay. So I want everyone to take a minute, 30 seconds. We want to wrap up at 4:30. And we'll start in the way that we started, in that order. Just for 30 seconds, your thoughts about this conversation. I think maybe the question is not, is it too high or not high enough? I think the question is probably how we allocate and how we use it and what we fund there. I don't know. That's what I'm thinking. But I want your closing thoughts on all this conversation, taking into account what you've said, what others have said, and also what the conversation will still continue. So, Deputy Chief Taylor, Mr. Randolph, Mr. Cranks, Ms. Murphy, Ms. Armstrong, and Dr. Hildreth, thank you all for joining me. But I want your thoughts before we close it out.
Yes, ma'am, I'll go really quick. Our department is trying to do a lot of different things. We're understaffed in that regard. We're doing the best we can with what we got. And we're going to, at times, rob Peter to pay Paul. But I don't disagree with anybody on the board, though, or on this panel. I think there needs to be an emphasis on mental health. I don't think it can be all through the police. And if you've ever heard Chief Drake speak, he said it a million times. It's so true. We will never arrest our way out of our problems. We have to figure out different alternatives, and that's where our department's trying to step in that regard. And I appreciate Mr. Randolph's help and anybody else that wants to. We are not going to turn away anybody that wants to help us. I can tell you that right now. So thank you so much for offering this venue for everyone, ma'am.
Thank you. Mr. Randolph.
Sorry about that. Thank you, guys. And I enjoyed being on this panel and hearing all these perspectives. Where I'm coming from, I agree with everyone. You know, crisis response the city needs a way more robust crisis response with a lot of different variables there. We're gonna, when we start programs for crisis response, we're gonna find more individuals in need, and we're gonna need to fund treatment for those individuals, outpatient and long-term, which is going to be difficult. And that we have a lack of resources for the public when it comes to mental health care. And crisis response is part of a spectrum. It's actually the last stop after all of these many things have gone wrong in the mental health system. And we need to not just address the crisis response, but the rest of the system as well that leads people to these dangerous situations. Now, this little niche here is where I work, but there is a far more robust mental health system that also needs a lot of help. And I really appreciate you guys letting me talk and hearing my perspective today.
Thank you. Mr. Krings.
I want to note that Ms. Armstrong said in the chat that she's got a hard stop at 4:30, so I want to let her go first if she needs to.
Oh, Ms. Murphy, okay.
Ms.
Thank you,
Armstrong,
Andrew.
yeah.
I appreciate that. Yeah, I'm sorry. I
Yes,
do
Ms.
have a hard
Armstrong.
stop. But I'll be brief. Again, I want to state that I'm not on either side. I agree with everyone, and that there are varying ideas and opinions on this topic. And I do think it's important that we leverage everyone to kind of get to where we need to go. Nashville is continuing to grow, and so the opinions and the problems are going to continue to grow. So thank you for providing us with this venue. But again, my closing thoughts are only from Antioch. So thank you guys.
Thank you for being here. We appreciate it. Mr.
Yeah,
Krings.
yes, thank you. I'll just say that I do think that it is a question of too much or too little. I do think it is too much at the moment, and I already gave the reasons for that. In some, we have situated policing and criminal legal system as the answer to more problems than they are actually the answer to, and we funded them as such. And I think the answer to that problem of the fact that they do too much, that we're asking them to do too much, then we're funding them to do too much, is to start to redirect funds in other directions that will, in the long run, prevent the need for dependence upon them in the ways that we do currently, and in the short term as well with mental health and other violence interruption first response. So I want to invite us to expand our conception of public safety, to incorporate things like housing, transit, all the things that make for safe and thriving communities, and not just to think narrowly and to think that police are the answer to all of our problems, when I think even police officers would say that that's not the case. Thank you.
Thank you. And please, for clarification, when I said the cost is not too high or too low, I'm not talking about specifically the police department. I'm saying that what I'm hearing is that we're saying public safety. And we define public safety to not only be the police. And so if you're looking at it globally as public safety, and you take all of that money, depending on where you put it, we're still talking about everything being public safety. And so let me make that clarification because I think we're talking public safety as a global idea or concept. Miss Murphy.
Yes, I just want to say that I agree with what you just said, and we're just trying to get people to stop thinking so narrowly about public safety and maybe start thinking more about community health. The health of our communities, the viabilities of our communities. Do our policies help us to live together and cooperate with each other, or do they further draw more divisions between us? And we have to think about that in every aspect of our policymaking. And I think that's what we're asking for people to do.
Thank you. Dr. Idris, a question did come in at the last minute, and I want you to look at this in your closing remarks. The question said, are we funding the public entities that are designed, equipped, and commissioned to provide these services? And the person went on to say, and it might be one or two people, I have a question for Dr. Idred. According to the report from the Nashville People's Budget that I shared, 36% of the general fund on police, the jail, and the criminal legal system, which is more than the city spends on affordable housing, transportation, public health, parks, etc. Based on your remarks, I agree it's important to come to an understanding as a community of what the right balance should be. Do you think that MMPD should get an even larger share of the general fund, or should some of the funds be redirected to those other parts of the budget that are underfunded, like affordable housing and public health?
All right, so there's a little bit of a dodge. The councilwoman and I discussed what my position would be, how I would enter into this conversation. And I stated that I was going to be identified to my work on the board, my work with the 37208. And I think I have a reputation for being a structuralist. So looking at all of that, that's a value judgment. I have a personal opinion about it, and I'm not going to share that here. What I do want to say is, be careful with just the big pie charts when we're looking at very large public budgets. The questions that I believe that the questioner is pointing to is it would be really important to go into the line items about those areas of direct concern, right? Because look, there's some things in that public safety slot that they're talking about. I think it includes the courts. That also includes the civil matters, the non-criminal things that happen with courts. And part of what keeps us as a community together is we have a place to go adjudicate our claims, right? So are we saying that we want to defund all of the courts as well? We have to fillet it apart, and we don't have enough time. I certainly know that I was not able to really spend the time and find the information there. But if this was my job to do, if I was asked to do this with folk, we'd carve out 4 or 5 hours. We'd get all those public budget documents, and we would look by line. And then we would start seeing, and perhaps the people themselves and the council member and her 39 colleagues are going to say, why is it over here when perhaps it ought to be over there? Thank you.
All right. Well, again, thank you all so much. We went a little bit over. I want to thank you all for being here and for all the perspective. We have to keep our people safe. It's very, very important. How we do that matters, whether it's policy, funding, budget, all of it. You've all given me and my colleagues a lot to think about. I'm grateful to the MMPD for the programs that they're looking at and all the new initiatives that was not there before that Chief Drake is trying to do. I hear the people's budget about should those be in the police department, as lofty as they are, is that the right place for it? I hear when we talk about let's not narrowly define public safety to just be the court system and policing. What are we doing with affordable housing? What are we doing with education? What are we doing with a lot of things? That is all of it as a whole. And I also hear that within our police department, are there things that we should be funding them for that we're not funded? And so it has to be a complete look at the whole picture, at what makes Nashville safe. Thank you all so much for this wonderful conversation. This will be on YouTube. I'll send it out as an email. If you have further questions, some of the panelists' information is on there. You can reach me online, email as well. You can call myself, 615-285-5555. I can't remember the number now. 585-2558. It's been a long day. Thank you all so much. I hope you enjoy the rest of your weekend. Thanks to all my panelists. I really do appreciate you. And thank you all for all that you're doing for Nashville. Have a good afternoon, everyone.
Thank you, ma'am. Y'all too.
Thank you. Thank you.
Appreciate you so much. Thank you.
Thank you. Thank you so much.
Thank you. It's good to meet you.
Thank you. Thank you. You too.